everyone. We're back with another episode of SLP's Wine and Cheese. I'm Maria.
I'm Deb, and welcome our amazing guest.
Hi, I'm Jessica Perez. I'm from Montville, New Jersey, and I am a school psychologist. I guess I was. So I practiced for 7 years in a public school in New Jersey, and I actually resigned in June. So not practicing in a school. I'm technically not a school psychologist anymore. I am currently a neuropsychological technician working underneath Dr. McGuire here. And I've been doing that, even when I was still a school psychologist for like 2 or 3 years with her.
I'm Dr. Leah McGuire. I have a practice in Watchung, New Jersey. I'm a licensed clinical psychologist in New York, New Jersey, and Pennsylvania.
She's a big shot.
And I'm a nationally certified school psychologist, and I specialize in pediatric neuropsychology.
Oh my goodness, how did you have time to do all of that?
Yes, I feel so special. Just in your
I do too. Sometimes I can't believe what Leah can accomplish in the same 24 hours that I have.
Wait, there's an expression that like Beyonce has 24 hours in a day too or something. So if we all hold ourselves against Beyonce, we're all disappointed.
Right, yeah, I've seen that.
That is just too much pressure. So we're having a product of Italy. We're having fancy wine. We're having Rivamonte or Rivamonti. It's from Scout and Cellar, which is a very nice company. This is a Prosecco wine. So this company is, their grapes are totally organic and vegan, and they really pride themselves on the quality of their grapes because their wine has 0 pesticides, 0 preservatives, 0 added chemicals, 0 sugars, and 0 animal byproducts. So it's really awesome, and we got this wine from Michelle Doyle. So if anybody wants to purchase this very fizzy and nice wine, you can find her on Nature's_Intention 2018. But we're going to tag her in our post. So, but anyway, this Prosecco is very fizzy.
Yes.
Which, if I'm going to let that up for interpretation. It's very fizzy, so we paired it with goat cheese to like balance the fizziness. So I'm going to vote drink it because the cheese helped it with the fizziness. But
I like bubbly wine.
Fizzy.
Maria's a baby.
The word fizzy just keeps replaying in my head, but it's light. It's a light and fizzy. But it's good. I'm drinking it. I'm not going to complain.
I vote drink it. I like it. But I am also a fan of carbonated beverages.
Right.
Like I like club soda and LaCroix and stuff. So I like it, and I vote drink it. And I like our cheese pairing that you gave us here with the goat cheese. What are you guys drinking?
So it's a Cab Sav. It's from California, and
We don't have any of the details that you guys have about our wine, but it has a government warning on it.
Okay. How does it taste?
Yeah, really good. It's a Cab Sav, so it's like not too bold, not too heavy.
It's smooth and it's easy and it's calm, and I need it at the end of my Tuesday.
Yeah.
Right. We all need it.
Yeah, I've had an insane week. It's just Tuesday. I can't believe it's only Tuesday, but it's been crazy. So I hear that. So let's get into some background information. Can you two take turns and tell us a little bit about where you went to school, what inspired you to join the field, and what has your journey been like to where you are currently?
Yeah, I'll go first. It's Jessica. I did my undergrad at Bucknell, and my major was actually elementary education and Spanish. So I was a double major. I was going to undergrad to be an elementary teacher. And I got to my senior year, went to start my student teaching and was like, no, something just didn't feel right.
Mm-hmm.
Right. Like I grew up always wanting to be a teacher, and I was like, this is what I'm going to do. Like I love kids. I'm a kid at heart. I was always super interested in like how kids learn. So I was like, yeah, I'll be a teacher. And then I just stumbled upon school psychology and was like, this might be more my speed. So after I graduated, I immediately applied to grad school and went to Teachers College at Columbia University, which was awesome. And obviously that is in New York State. So my training is actually in New York State's school psychology, which is the laws and the code and everything is a little bit different than New Jersey. But it really helps being knowledgeable of how the code is a little bit different and how our roles are different in Jersey versus New York. So that program is really clinically based. So I got a lot of awesome clinical experience, and then did my internship in the third year in Jersey, which was awesome because then I got a chance to kind of apply that to a school setting, and graduated, ended up getting a job near the district that I was doing my internship in, worked in that district for a year, and then actually took over the position for my mentor during my internship, which was awesome. I loved my district. They're amazing. Shout out to Hillsdale, New Jersey. So I worked there for 6 years and just resigned after I had a baby.
Oh, so cute.
Can we get a cheers to that?
Oh, yeah.
Yeah, she's already in bed or else I do. Cheers to babies. So yeah, I resigned after I had her, and then I've been working with Leah as a neuropsych technician, and it's been awesome. I've always had an interest in neuropsychology, so I love getting to still have my foot in the waters of psych and neuropsych, but still being home with Evelyn. So it's been awesome.
That's great.
That's great that you have, you get to do both, that you found a balance between the two.
Yeah.
Yeah, and honestly, when I was working in a school, all the parents would look at me and be like, you don't get it. You're not a parent yet. And I would look at them and be like, you're right. I'm not, I don't get it. And I knew that some things would change when I became a parent, and it really has. I can see things from more than one side so much more clearly now. And I think that's awesome. And it's good for parents to hear that I'm considering that, and I kind of get where they're coming from. I think that they're more willing to trust me and hear what I'm saying when I bring that up, and use a little bit of my experience as a mom. And it's awesome. So that's where I am now.
So for me, it started in kindergarten, and then a short 22 years later, plus a 2-year postdoc, here I am. No, I have a similar story to Jessie here. So I did undergrad at Bucknell. I was a psychology major. When I graduated from Bucknell, I got 3 master's degrees in school psychology from Teachers College, Columbia.
That is fantastic.
Yeah, so I have an EDM, a Master's of Arts, and a Master's of Philosophy.
How long did that take?
I'm like Doogie Howser. I just started. No. So I stayed on. It was on my way to getting my PhD, so I ended up getting my PhD from Columbia. The whole thing, start to finish, was 6 years.
Okay.
And then after that, I did a 2-year postdoctoral fellowship in neuropsychology, which is a requirement if you're going on to become board certified. You need that 2-year specialty. And then clinically, I've worked in a lot of different settings. So I've worked in outpatient clinics, hospitals, day and residential treatment centers, public and private schools. And currently I'm in private practice. And I do neuropsych assessment there. And then I also am an adjunct professor at Columbia University, where I teach neuropsych assessment because I love it. And I used to do a lot of research on PTSD and trauma and things like that at Bellevue Hospital, because I had the most amazing mentor at Columbia. And that's kind of what drove me into the PhD program there, was really just connecting with this amazingly brilliant mentor there. And I always knew I was going to go into psychology because my helping profession, my dad's a doctor, my mom's a nurse. And then I ended up shadowing my aunt, who's a school psychologist, and thought, well, this is the coolest job ever. So that's why I started on the school psych path. And then I met my amazing mentor and totally thought, why not hang out in school for another 1,000 years and become a doctor?
I love it. I want to be Dr. Deb one day.
Yeah,
so
she does.
So hopefully.
I don't, but she does.
I do.
But I'm going to help her.
I like the fizzy wine. She doesn't.
Yeah,
We'll drink the wine while you're in school.
Okay.
I'll help you
I'll
out,
drink
girl.
it then too.
Yeah.
I'm wondering how both of you would like to impact or influence your fields.
Yeah, so I guess I'm not really sure where the future holds for me as far as if I'll go back to working in a public school district in a couple of years or if I'll stay in the private practice realm. But when I was working in a school, I worked underneath a wonderful director, and her big mentality was child first. Like, never forget why you're doing what you're doing. We're not, yes, I provided tons of services to, and we do provide services to parents and to schools and to teachers, but really we're here for the kids. So in whatever placement and place that I'm going, I think it's really important to always remember that, like, we're kids at heart. We were kids at one point too. We want just to be there for the kids.
So I mean, I guess for me within the private practice setting, what I'm hearing from a lot of my colleagues is that the kids that you guys are all servicing need so much from you guys, and you feel kind of stuck for time and stuck for resources, and like you can't give them, all the time and energy that you would love to give to each and every kid. And so I think one of the benefits of being in private practice is that, we have that time to spend with each family, to spend with each child, to talk to everybody on their team, to put all the pieces together, to get everybody working together and communicating. And so, I mean, for me, the way I want to impact the field is just, the kind of when I get my updates from families a few years down the road about all the things that are going so well for their kids. And those are, my favorite emails in the whole world and my favorite phone calls in the world to get.
Yeah.
Stay tuned. After the break, we're going to talk about neuropsych evals. This episode of SLP's Wine and Cheese is brought to you by SpeechTherapyPD.com. It's a 100% SLP-owned website that specializes in practical, engaging, evidence-based video and audio courses. There's more than 600 hours of courses available on demand.
Yes, there are weekly live and interactive courses and pod courses. They offer unlimited plans starting at $89 a year. And now you can get $10 off with the code WINE, WINE. So enter WINE at checkout.
So, what exactly is a neuropsych evaluation?
The official definition of a neuropsych eval would just be kind of the relationship between behavior, emotion, cognition, and brain function. But really what that means is we're looking at a whole lot of skills for these kids. So we're going kind of across the board to see what their strengths are, what their needs are, and then most importantly, kind of what to do with those things, giving them a game plan of kind of what interventions they might need, what supports they might need, what's going really well for them that they can use to help bolster areas of difficulty for them. So for a lot of people, it's just a really great understanding of who they are.
Mm-hmm. Why do people get these types of evaluations?
There's a million reasons, and we don't have enough
You can give me like
time to go through all of them.
3 reasons.
I'll give you like 2.
Okay.
Yeah. So oftentimes we have parents that come to us. Most of the time it's parents coming to us looking for a private eval. And what they're really looking for is kind of a means to an end, the eval. They want us to kind of summarize maybe some things that they already know, some things that they don't know about their child. And they're really looking for, where do we go from here? So these evaluations are super broad, and they look at a lot of different areas, from memory to learning to academic achievement to
language.
We do language stuff, of course, and social emotional stuff and behavioral stuff, and really the end goal is to, you know, how do we address all of these issues? And is there really one main thing that is causing any of these difficulties in any areas of these functioning that these children are experiencing? So,
I mean, a lot of times neuropsych's not like typically like your first stop, because it's really time intensive and it's a lot of, you know, it's not like where you would first go. But yeah, usually if there's a referral from like a school or a speech and language provider, psychologist, psychiatrist, pediatrician, whoever it is, it's typically because something's going on with that kid and they're doing all the best work that they can for that kid and not seeing any progress or any growth. And so they're saying, and I'm sure you guys have patients like this or students like this where you're saying like, I might be missing something. Is there something else going on I didn't think about? Like, I think it's an expressive language disorder, but what else is it? What's happening? And so a lot of times kids will come in with incorrect diagnoses. So for example, I've had kids come in with an anxiety disorder and the therapist is doing the best treatment for anxiety and they're on great meds for anxiety. But it turns out that they have premenstrual dysphoric disorder and they really just need a birth control pill. Or I've had kids come in diagnosed with like ADHD. And so everyone's saying they're not paying attention. When I'm talking, they're ignoring me. And it turns out it's a receptive language disorder. So they're not consistently understanding the language that's being used. And so of course they're zoning out the same way, like, you know, if someone spoke to me in Spanish, my Spanish skills, unlike Jessie who majored in it, my Spanish skills are not that great. And so if you're going to speak to me in Spanish, I don't consistently understand you and I'm going to zone out at some point and possibly look inattentive. So a lot of times it's just getting that clarity and then from that clarity having a really great game plan.
Yeah.
Wow.
Right. So it just helps to get to a more specific diagnosis so that you can best assist that person.
Yeah.
Game plan, really.
Yeah. And then the other piece is just like even like to have a diagnosis of ADHD or something like that, that can be super vague.
Yeah.
So what does that mean? Or a diagnosis of anxiety, what does that even mean for people? So the neuropsych eval goes kind of a step further. So for example, for ADHD, it might be like, yeah, sure, you have ADHD, we already knew that, but like your auditory attention is terrible, your visual attention is great. You have trouble with inhibition, which means like you have trouble kind of thinking before you act. You might be saying things without thinking about it or grabbing stuff. Or maybe your working memory is really terrible. So when you're like holding stuff in your mind and shifting it around, it's getting lost. So it kind of helps like tailor the interventions because we know exactly where the areas of deficit are, so that we can build them up. If that makes sense.
I think I have all those things.
I also want an MRI because I want to see my brain. I think it probably looks good.
I feel like that's probably unnecessary exposure to radiation, but
yeah.
Maria,
this is less intensive, right? This is less intensive.
Yes.
Right? So this is a good
It is a shame.
What'd you say?
Yeah. I was just saying, it's a shame that we know all of these tests because I've always said I made a huge mistake not having like someone else in the program that was like a couple years older than me administer them to me because I'm so curious as to how I would perform on them. Very well. You say that, but like sometimes I feel like, oh my God, like I really don't know what this answer is. Like I have to look and see before the kid answers. I'm so
that
curious.
happened to me in kindergarten.
Right.
Yes. Like because they have these like specific targets for like the F&P testing for books and stuff, and then they're like, I'm like, I don't know what's the same. They're like, oh, these toys are alive, are not alive, but the dog is alive, but they can all be played with. And I'm like, okay, well, I had no idea.
There's also like the big brown dog ate all of the cat's food, and it's like we have some tests where they have, I guess that's working memory, auditory recall. I'm like, those sentences are crazy, and this like 6-year-old got it. I'm like, what is it? So
sometimes it's like, do you remember the sentence? And then they say it, and I'm like, wait, is that what it was?
It sounded good though.
Yeah.
I feel like that's why it's good to record your evals to go back, you know?
Yeah.
That's why it's a good thing that we have the answers on our side.
Yeah. We need that. We need
all
the
answers are facing us.
That's good.
Great. So what do you have any children that you adapt the psychological testing for? I was thinking about this because like I work in a school with kids with severe communication disorders, and like a lot of times it's hard to get, how do you get like the verbal IQ, or if the child is nonverbal, or just like different accommodations, or how do you adapt a test? And that's probably difficult.
Yeah.
So I'm just curious, like what your experience in that has been.
Yeah, I love the question. So sometimes there are just tests that are straight up like the nonverbal IQ test. So that's a no-brainer because you just would grab that one. But a lot of the times it's just kind of being creative with the tests that we do have. So
or even not breaking standardization. Like there are certain levels of like queries and prompts and like, you know, repetitions that we can give a kid. So if they have or maybe not diagnosed ADHD yet, but if they're all over the room and they're not looking and they say, what? Like, can you repeat that again? And we say, no, it's going to look like they maybe don't know the answer, but really it was their behavior that got in the way of them even hearing the answer, and then they couldn't respond. So sometimes we will what we call like testing the limits. I don't know if you guys do that too sometimes in your evals, but we'll give the test according to full standardization procedures, and then we'll go back, or while we're doing it, we'll just make note on the protocol, like that we were testing the limits here, we didn't follow standardization, and with these modifications, they were able to give the correct answer. We'll come across that sometimes with kids who have expressive language disorders. They'll come in, either they're not able to express themselves, but if we say, is it this or this, they can point to it. And then we know that at least they have that knowledge in their head. They just can't express it. And it's as a result of their disorder. You know, and we'll write that in our report. We're really mindful of really explaining what that means in our report in a very parent-friendly way.
And there are there are measures that definitely, like Jessie said, and there are also measures that tease it out a bit further. So one of the commonly used IQ tests is the WISC, but there's also something called the WISC integrated, which again is like if a child couldn't express it for some reason, there's like a multiple choice format where they can point to the word and things like that.
Wexler?
Oh,
Wexler? It's spelled Wexler.
I think it's like tomato. I think you're both correct.
Just say the WISC.
Like dysphagia, dysphagia.
Right.
Yes. Sometimes it's more fun than that. So like, I don't know if you guys ever use the BAME test of basic concepts, speech and language providers, but it looks at kind of the 50 most commonly used basic concepts
at all.
I was going to mention, about evaluations. We have a lot of students that are bilingual. So a lot of times those tests are not necessarily standardized on children who have like a second language or an emerging language. So I was wondering about like those assessments, probably the same thing, right? A lot of the standardized tests are the same or similar.
They are standardized for us.
Yeah.
So they're standardized on different languages. And then, so like the BAME looks at like basic concepts, for example. And so it'll be like point to right, point to left, point to last. And I had a patient come in who was super inattentive for everything that wasn't High School Musical. So I recreated the entire BAME test of basic concepts using like Zac Efron and all the other characters. And it was like, point to the Zac on the left, point to the furthest Zac. So we get pretty
yeah. Okay. Sounds good, Maria.
Yeah. I hope that one's like laminated, you know. I'll take that.
It's laminated for all the drool and things like that.
Yeah, exactly.
But it's pretty creative in our setting.
Really, right. The Zac Efron. Can I request a Ryan Gosling test? Oh, I will score high on that one.
Yeah.
That one too.
Yeah, we'll have a flathead created for you. So really, it's not Jessica Perez that's giving you the eval. It's Ryan Gosling.
And not at all creepy.
Yeah.
Not at all creepy. It's like, hey girl, we're neuropsych.
All right, that sounds like a lot.
I mean, I feel like we could design a whole battery for you around all of your celebrity crushes.
Yes.
Okay.
But yeah, we do have to get creative.
Yeah, and we do a lot of environmental changes just because that's more helpful for the classroom. So that's stuff you guys can do in your sessions too. So it's stuff like, if I put a piece of Velcro under the table, does that help with your attention? If you're sitting on a balance disc, does that help with your attention. So that kind of stuff as well.
Yeah, we'll like informally do that stuff during the sessions because that'll be helpful then when we are writing the report and making recommendations to the parent for home, the teachers for school.
Yeah.
Oh, that's great.
And so I mentioned I don't do evaluations, but I do like small assessments quarterly just to measure progress. And I do find like I like to, anybody who I have who struggles to maintain attention, I always give them a yoga ball and Play-Doh just so that like their body is busy so that I can have their brain for that little assessment so that I can have all of their best answers. And I do find that it does help them significantly. But then I'll always, like you mentioned, test the limits of it. So I want to know how much assistance that individual needs to get it 100%. And sometimes it's like just an example because they don't know that analogy or they can't think of what is the opposite of entrance. That was nobody could think of the opposite of entrance. I'm like, the sign is everywhere. How do you know you can leave? What does that red sign say?
Right.
So sometimes it's just like background knowledge that they don't have, and I don't want to like score them in an area where they're actually fine. So I have to see what level of assistance they require and what type of assistance. Like maybe they just need more like visuals, or maybe they just benefit from repetitions. I benefit from repetitions.
Next up, we talk about some common disorders, but first, a commercial break. Hey SLPs, do you know what a throat scope is? It's like a clear tongue depressor that lights up. We all know how important it is to do a really thorough oral mechanism examination before starting therapy. But really, how can you see what's going on if there's no light and if you're using a tongue depressor made of wood and it's blocking the things that you're looking at? Well, you're in luck because Throat Scope is what can help you figure it all out. Throat Scope improves patient oral examination and outcomes because it integrates a natural light source to provide a complete intraoral illumination for improved patient examination and outcomes. So, if you want to learn more about Throat Scope, check them out on Instagram at ThroatScope or check out their website, throatscope.com. Now, back to the show.
Are you drunk? No. So, I'm wondering if we can talk about a couple different types of disorders, just ones that I hear about quite often. So, first off, anxiety disorders. I feel like currently in today's society, very many people, they have anxiety and they also might wrongfully claim to have anxiety. So can you tell us a little bit about what anxiety entails and like maybe how to distinguish from ordinary worry?
Yeah, absolutely. So first, I love that you distinguished worry from anxiety. That's a really good point, that sometimes it is really about semantics. And so a lot of people do experience daily worries, but they're not really, that worry isn't impacting them in a functional way. And so it's not really something that's hindering their ability to get through their day. And they're still doing very well. But on the other hand, there are some people who experience symptoms that might be consistent with a generalized anxiety disorder.
Yeah. And so we'll refer to it as a GAD.
Yeah, GAD, generalized anxiety disorder.
Yeah, so it can look a little different in adults versus children. So in the criteria, if you're looking for diagnosing a child with generalized anxiety disorder, only one of these following symptoms is actually required for the diagnosis. Which would be different from an adult who would need at least 3 or more of the following 6 symptoms. So just keep that in mind when I'm reading these. So restlessness or feeling keyed up or on edge. I mean, you guys can keep track. You tell me what you think. If you feel like you have these, you guys can answer. So restlessness or feeling keyed up or on edge.
No, I like to sleep. I liked it.
Yeah, no, I don't ever.
Okay, here's the next one. Being easily fatigued.
Yes.
No, I'm kind of worried. How come I have too much energy?
So kind of agree. I'm like, where do you find it? Yeah.
Yeah. What about difficulty concentrating or mind going blank?
No.
Unless someone talking is boring, like, all right, I get it. You collect coins, you know, I don't know, something like that.
Even so,
Something I'm not
I
interested in.
can hone in on that coin conversation.
Oh, now I feel bad to anyone who collects coins. I would probably try to find something to talk about, but you know what I mean.
Yeah. No, I can focus on
That's a bad
things
example now.
pretty easily, I think.
What about irritability? And I guess you guys can answer for each other if the other one is irritable.
No. Oh, thanks.
No, I don't think that either of us are irritable. But yeah, I'm definitely not. I should get a little bit more irritated.
You probably should.
I should, but I don't. I don't understand the point.
I tell Deb to get irritated.
Why? I think it gets
True. It does give wrinkles.
I don't want to get
All right.
irritated.
I'm gonna give myself
No wrinkles. All right. What about muscle tension?
I do notice that. So like sometimes I have to be mindful of where my shoulders are because often they're quite up close to my ears. And I also clench my jaw. So
Yeah, those somatic complaints are actually really common in kids. A lot of them will say that like their belly hurts, you know, or
Headaches.
they have headaches, or yeah, they feel like tight up here. That's a super common symptoms that kids will report. And then the last one is a sleep disturbance. So either difficulty falling asleep, difficulty staying asleep, having unsatisfying sleep, like you wake up in the morning, even though you know you slept 7 hours, you're still like exhausted.
Well, I have that, but I also have sleep apnea, and that's what I think where it's difficult when there's like other things happening with the child. Like, you know, we see
I
like,
love it. I feel
our myofunctional episode, like the big tonsils can cause like a sleep disturbance, which causes lethargy, which causes poor attention in class, and then like it all comes back to like, yeah, they have large tonsils. So it's so much, so many things.
so I love that you said that. I feel like you're like an audience plant for us, because I mean, one thing we want to say is that that's kind of the benefit of the neuropsych, is that, you know, you can have a lot of different characteristics and symptoms for a lot of different reasons. So like you said, sleep disturbance can be caused by a different sleep disorder, or even just like difficulty concentrating. Of course, that could be related to something else, whether it's diagnostically or environmentally. And so a lot of people who do come in, and I had spoken a little bit earlier about this, but like with a generalized anxiety disorder, it could be misdiagnosed. So we talked about patients who've come in with generalized anxiety disorder, and it turns out to be hormonally based, and it's premenstrual dysphoric disorder, and you send them to their OB, and a birth control pill can assist them with that. And so, you know, just for people who are listening, I don't want them to necessarily go through all these symptoms and say like, oh my gosh, I have that thing, because there are a lot of explanations. Come to us for a neuropsych eval, we can rule it out for you. You know, but the other pieces of
Right.
Don't
just Google it.
what is that? PubMed? What is that?
No, WebMD.
WebMD. Yeah. Like you're dead.
Yeah,
Danger.
Yeah, so I think, you know, there is some danger to just going through and saying yes to symptoms. If you do feel like you do experience a lot of anxiety that's functionally impacting you, whether it's in work or school or in your social lives, I do think it's important to get support. Some really effective treatment for generalized anxiety disorder is called cognitive behavioral therapy, and it has a lot of research behind it. So if anyone's listening and they think that possibly they have this, you know, it can't hurt to go talk to somebody about it.
Right, because also our entire field, all of rehab is based on neuroplasticity. So if somebody can have a stroke and then relearn behaviors, then you at 30 are able to go to therapy and make your mental health more aligned with success. So it's not like it's ever too late. And sometimes I think just not talking about something for a long time allows things to fester, and then within your head, like it gets built up more and more. So, but like if you just gave yourself an outlet, then maybe you can alleviate some of your anxiety. But
and a lot of it is just like, you know, maybe you're having thoughts that aren't super helpful thoughts. So, you know, the same event can be experienced a lot of different ways. Like you can be on a roller coaster and be like, this is great. When do they take my picture? I have to smile for it. Or you can be on that same roller coaster thinking like, I saw a documentary. This is how I die. You know, so a lot of it has to do with your thinking patterns.
Yeah. Which is what the core of CBT really addresses.
Yeah.
What you were talking about earlier when you said like not getting satisfying sleep, I think I get satisfying sleep, but it is difficult for me to wake up because I do have this process where I lay in bed thinking about all of the things I have to do that day and all of the energy that it will require and the length of time it will be before I get back to the bed. And I think that just
I know what you mean.
That just gives me a little bit of overwhelm where I'm like, I just want to stay here. I don't care if I'm late.
Like you miss your bed while you're still
while
in
I'm
the
still
bed.
in it.
Like,
Yeah.
it's gonna be so long
It's
until
so
we see
long.
each other again.
And I'm going to have to go out there and sing and dance and blow bubbles. But I love my job.
I mean, but I think you bring up a good point about just like sleep is a really important thing. And I think all of us without sleep are pretty terrible people. And so when people do come in for neuropsych evals, in addition to like the vision and the hearing and all the things, the language, we also look at things like sleep and nutrition because those can play a huge role in how you're functioning in your day to day.
The ASHA Journal actually had an article about that. See, I read that. That's our article from our association. Yes, they give some research articles, and they talked about the importance of sleep and just really, in a nutshell, any little issue someone can have, it's like, oh, it could be from lack of sleep. Like anything, just
because it's like how your brain kind of like modulates.
Yeah.
I think some of these things are symptoms in some settings, but also like strengths in other ways, if that makes sense. So like you might be like, oh, I'm super anxious in this one way, but also that makes me like really meticulous and attentive to details. So like it's not necessarily
So like I think that it has something to do with like why many creatives do have these like presentations.
Bro, say personality.
Yeah, I mean, it reminds me a lot of even just like ADHD. And when you talk about that like in a school setting, they might say like, oh, Jane is so off topic with her writing. She's always tangential. But right, in a comedy club, you're saying like, man, is she clever? She's so outside of the box. She has these great ideas that no one would think of. Or like in a tech startup company, you're like, man, nobody thought of that.
Yeah.
That person's really great off the cuff.
Going
so
back.
now, yes. What can you tell us about ADHD and hyperactivity disorder?
The presentation.
So obviously in a school setting, I feel like one of the most commonly seen symptoms that every child has is either they are inattentive and or hyperactive. But that symptom could mean a million different things, especially in a school setting. Like you can have a kid that's presenting as inattentive when really they have massive anxiety, and that's just how they're presenting their anxiety. You can have kids that are hyperactive and are trying to almost get out of the situation and like distract you when really they're also anxious. So inattentive and hyperactivity, they're symptoms, but really the core of ADHD is, like you said, Maria, it is difficulty with your executive functioning processes, which is in your frontal lobe. It's all of your planning and organization and inhibition and those kinds of skills.
I call it the mom of your brain. Like it's the mom of your brain that's like, don't pay attention to that thing over there. Your teacher's talking, or like, remember your calculator, you need it today. And so a lot of parents, when they come in, will be like, oh, I do all that for my kid. But I mean, Jessie made a good point that a lot of kids might symptom-wise check out as having ADHD, but that's why it's so important to go into the classroom and see like, are you inattentive because like you're sitting on a thumbtack and that's distracting you?
And or the kid next to you won't stop talking, and so you can't pay attention either.
Yeah, so it's really important to do that classroom observation.
Maybe that like a lot of students have like an undiagnosed vision impairment. I went to a whole PD on that. It was presented by an occupational therapist, and she was like, first thing is you can't even see, or a hearing impairment. So those are like to rule out.
I know like 4 people who, as kids, they got glasses and they were like, "Whoa, this is what the world looks like."
I feel like the vision, the hearing, the language piece, like all of that really has to be assessed as well. So when people are coming in, I mean, one of the first questions we check in on is, when was your last vision and hearing eval? How was it? And sometimes we'll send them right down the hallway to get their hearing checked because, you know, we can't be saying it's ADHD if it's not.
Right.
But I mean, I think, you know, ADHD is another one of those things that, like, if it wasn't evolutionarily advantageous to have it for so many years, everybody with ADHD would not be here with us today. So, like, for example, like back when we were hunters, like if you're going to go seek out new food sources, even though you might have an okay food source, but you want to know what's happening next. Or you might, or for example, you know, you might be focused on something, but if someone's coming to attack you or an animal's coming to attack you, you're going to notice that because you're going to shift your attention over to that item that people who are hyper-focused might not see. And there's a lot of research that shows that a lot of really successful people actually have ADHD. So there's a very high number of CEOs in companies that have ADHD because they're outside of the box thinkers, they're willing to take risks, and who's making sure that they get to their appointment on time and they have their pen and pencil with them.
You have people.
They have a secretary. So there's a lot of research to show that ADHD can be really helpful. There was just research done on contributions of children to group settings, and it showed that kids who had ADHD had more creative ideas to contribute to the group. So in a lot of ways, you know, I do talk about, you know, I guess the DSM-5, which we use to diagnose, talks a lot about symptoms, but a lot of these things are really just qualities about a person. And in some ways, they're really advantageous to that person. In other ways, it can get in their way.
Right. I've been reading so many articles just about like dealing with ADHD on a daily basis and like how to deal with, like, how to relate to people with ADHD, but then also Instagrams that are strictly about ADHD, and just kind of like, for the first time ever, is it being brought to my attention, like all of the benefits of having ADHD because of all the things that you're saying. I can't remember, if it's the ADD Attitude magazine or something like that. I'll tag it in the show notes so that people can follow that Instagram. But it's very helpful, I feel.
Yeah, it's also awesome to tell parents this when you're talking to a parent and giving a feedback after maybe diagnosing their child with ADHD. I always find that parents are so surprised to hear these positive things we have to say about ADHD, because probably in the past, all they've heard are the negative aspects of their child's inattention or hyperactivity, likely from the school. All they're hearing is how it's getting in the way. It's they can't do this because of it. They can't do that because of it. So when we're the first person to say anything positive about those symptoms, they're surprised and obviously so relieved. And what's wonderful is, in a school setting, once a child becomes 14, and I think you talked about this in the last podcast too, that's when a child starts to become a part of the IEP process and their meetings. And it's really helpful to share that feedback as a case manager to the child and be like, listen, this might be your diagnosis, and you might think this, and this about your symptoms and your, difficulties, but here are all of the strengths that come out of this part of you. And it's really awesome to be able to share that with these kids and these families and parents.
And we do, in our office, we actually do feedbacks, like for most ages, if they're cognitively able to attend it, and we might not give them a label, but we might call it like, hey, you know how you're feeling really wiggly in class? Like, yeah, you have the wiggle fidgets, and that's what happens when you're a wiggly guy. So just giving them some terms. But I mean, the same is true for autism. I think, when you think about autism as being like a hyper awareness to your environment, like how wonderful is that to be able to be in touch with all the small components of your environment that a lot of the neurotypical population just doesn't get to appreciate or know about.
Yeah.
Right. Being so interested in that sensory stimuli, like that somebody else might bypass and not, appreciate for what it is tactily. I don't know.
Right. That's the positive spin on it. But when it affects them in school and in every aspect of their life, that's when That's
Right.
the disorder, you know, that's in a nutshell, you know, like they can't focus on what the teacher's saying because the light is so bright or whatever, you know, whatever,
Yeah.
it's or something here. So, you know, or they didn't get sleep that day, something is like that, you know. But
I mean, so I definitely agree with you on that, but I also think part of the problem can be the environment.
Yeah.
Like sometimes to me, I'm like, isn't it weird that we expect kids starting at the age of 5 to sit for 8 hours a day? Like that's a very strange thing that we've invented.
yeah,
It is.
I'll just, you know, if I'm asking them questions and they're answering them and they're skipping around my room, I'll ask them to sit down. But if they don't, I'll just move on. I'm just still asking the questions
Right.
to get that, because I just want to be able to focus on the language. And maybe they have been cemented to a chair for too long and they just need some sort of like physical outlet.
Exactly. And the reality is that if they're going to see you, it's probably because in some way speech and language is difficult for them. So the least you could do is to make it enjoyable in other ways, because the speech and language stuff is probably hard for them.
Right. But I also feel like when you try to restrain someone, they try to rebel. So it's like often when you let them be a little bit more free, then they demonstrate more skills. So it's like, is their speech and language so significantly impacted, or is it like physically they're like dying to just move, and that's why they can't focus on what you're asking them because they're too fixated on the fact that they're sick of sitting in this chair and staring and writing and doing stuff like that.
well, with kids with autism, it's a bit of both. So you have to, like, it's like a fine line, because I have, like, some kids, like, they really can't be roaming around the room for my half-hour session. You know, we need to have, like, rules and expectations in the session. But, like, yeah, after 15 minutes of sitting and I see them getting jittery, I will give a break. You know, so that's, like, I think a fine line. Or before we sit, we'll do, like, some type of movement. I have a ball, I have a yoga mat, we'll do something. Or if I see them getting antsy, we'll try some deep breaths. No, but I can't just let them hang out for a half hour.
Well, they're not hanging out. They're talking to me.
Yeah, I'm just saying.
But I don't have anybody
right.
who's so severely impaired
Right.
that like I need to do that, and they all demonstrate this like soldier-like following directions throughout the entire school day. So I have no concern about their ability to do that. All they do is talk about like, oh, I got changed to red today, or I got a consequence. So they're completely aware of like what to do.
I get it.
Yeah, but it's a different population.
Yeah.
I feel like you're like setting them up to be successful in your office almost, because you're like,
yeah,
it's okay for you to do X, Y, and Z as long as we're still getting my stuff done.
That's how I feel. I mean, I only have 30 minutes, and I don't even have 30 minutes when it comes down to like going to get them, getting them settled, getting them packed up, and getting them back, doing whatever.
Taking data, writing session notes, you know, all that fun stuff.
Paperwork.
Yeah. Just keeping it real here.
Paperwork.
Weren't you just passionate about paperwork and that's why you became SLPs?
Oh my God.
It sounds like you're the perfect candidate for private practice.
I know, but not yet. I want my PhD first.
Oh, I feel like you could do both.
Not right now. I'm very busy. I'm also an adjunct professor.
Yes.
So
go Deb.
It's too much.
Again, Deb is going to do all the stuff, and I'm going to support her with wine on the sidelines, you know?
With wine. Cheers to that.
Just like you do all that, Deb, and I will be there.
Thank you.
I will be there for
okay.
You. Yes.
Yeah, I want to do all the things.
Deb wants to do all the things.
All the things.
Yes, and I'm good with just going with the flow. With the things. As a result of the things.
So, the last disorder I want to talk about that's commonly misunderstood is schizophrenia. And I know this is something that can't really be diagnosed in childhood, but you can have conduct disorders, right? So can you tell us a little bit about that?
I actually have a question. Before we answer this, do you really see kids with schizophrenia or like are in the prodromal stage of schizophrenia in your schools?
I haven't seen schizophrenia, but I have heard of pandas, which is the undiagnosed strep throat that looks like schizophrenia. I haven't had anyone with that, but I've heard.
Oh, I have a ton of experience.
So you're
with
thinking of
that.
pandas, and it looks like an obsessive compulsive
Looks like-
disorder. Yeah.
Yes, or it looks
But
like
it's actually
autism.
just related to the
I mean, it can present, I think it actually varies based on the child, but I've seen that when the child is sick and ill and has the strep infection, I see what I've experienced at least is the child presents with a lot of anxiety, like increase in anxiety, and also some depressive bouts too as a result of the strep bacteria. It's wild. It's crazy.
Yeah. That I
So,
have.
I mean, yeah, I guess from our perspective, the schizophrenia, like it's things like delusions, hallucinations. For you guys, it would kind of look like disorganized speech, some catatonic behavior or like really disorganized behavior, and then kind of things just like a lack of things. So things like a lack of emotional expression, things like that. I've had it kind of when I worked in like day and residential treatment, that I had patients who had like PTSD from very traumatic backgrounds and then schizophrenia as well. And it was just hard for them to stay grounded in reality a lot of the time. So they'd get kind of sidetracked by different things. I mean, the one thing that comes to mind is I have like a Zippy pouch that I had prizes in, and that was like a face. And one of my patients got into like a very big heated argument with the Zippy monster pouch thing. And so I quickly realized that was just like a really inappropriate thing for me to even have. It was while I was training, but like I shouldn't even have that Zippy pouch in my session with that.
And now
that
you know.
child. I don't use it anymore.
All right, so we're almost at our tips and tricks and closing quote segment, but first we want to remind you that you can follow us on Instagram at SLP's Wine and Cheese Pod _ between each word. You can follow us on Patreon. You go to www.patreon.com/SLP's Wine and Cheese. We will be uploading a bunch of freebies, also bonus episodes of the podcast, as well as video content. So check out the Patreon. It's always changing. And finally, we will be celebrating our 1-year anniversary show at the Creek in the Cave in Long Island City on Friday, May 31st at 7:30 p.m. We're going to have live music, and we're going to have Maria and myself, we're going to host a show, and we're going to have 4 comedians on the show, and we'll have them on as guests. So it'll be a really fun show to watch. It'll be a really fun show to listen to if you're too far away. But we look forward to everyone tuning in.
All right, so who wants to, I'll go with my tip or trick.
Okay.
So my tip or trick is to refer for a psycho educational eval. I'm inspired. It's my new goal for myself to pick a tip or trick that's inspired by the episode. But just as an SLP, if there's a student you're working with, don't be shy to bring up. It is a tough topic to bring up to parents, and I've had to bring it up before. And you just ask something like, have they seen anyone else outside of me? You know, just bring up those somewhat uncomfortable topics, but just, you know, don't be shy to refer out. So refer out. That's my tip or trick.
My trick is to give the child something that's going to keep their body busy.
Right, yeah, I know. Mine
When
should
you're
be something you can apply tomorrow.
Yeah.
But maybe you could call them and be like, how's it going? You know,
well,
maybe
or you could just, you can let it stir.
let
you
it
can let it stir in your brain.
there you
But
go.
I like to give kids Play-Doh.
Right.
We don't play with Play-Doh all the time. Play-Doh is only for like certain occasions. And I also only buy one color, so it can't get mixed.
Right.
So
yes.
I only have pink Play-Doh.
We didn't get to talk about OCD, you know. We didn't get to
No, we didn't.
That's for me and the mixing of the
Yeah,
colors.
you guys Have you tried the Orbeez beads? They're like the Orbeez beads, and you add water, and they're very tactile, and kids can play with them while they're doing it.
I keep telling myself I'm going to buy water beads, but I haven't yet. I haven't felt motivated to make
right now.
Yet.
Right
but
now.
I do. My students, they have to earn 200 points for their next party, and they're all at like 150 right now. So last time we did slime and popcorn, so maybe this time we'll do like water beads and pizza on 2 different, because everyone mostly is twice a week.
You tell me when they earn that, because I'd like to come. That sounds wonderful. I want it.
You need 200 more points.
I need 200 points. Okay.
The other thing is, I think
I have to make it desirable.
The tables is a good sneaky trick.
Yeah, I heard you say that earlier. That's a great idea. Velcro under the table.
I know, yes.
You'll be on Amazon Prime later. It'll be at your door by tomorrow.
Yeah,
Right.
super subtle, so easy. You can put it anywhere. You stick it under any desk, and you're done.
I'm gonna do that. I actually don't. I have it.
It's like gold.
Right. Someone's got to have it in a school system.
Right.
So my tip or trick is this. I got this in grad school, and it's my best friend, and I love this timer. It's a silent timer.
Oh.
It's called the Micron, if you want to look at it. And it's just got like 3 buttons, a lap, like if you want to keep track of it that way, a start or a stop, and then an on, off. And I love using it during sessions, especially with our kids that have a difficult time sustaining attention, or they want to guide what we're doing. Like they want to play the game, like they want to tell me the rules of the game, when really I'm like, no, we're doing block design and you have to follow you have to copy my designs. I can't copy yours right now. I'll be like, listen, 2 minutes on the timer for me, and then you get a minute. I feel like it really helps the kids who don't understand time and taking turns. It really helps them to be grounded in this, and there's really no arguing. There's no arguing because it's been 2 minutes. I told you it was going to be 2 minutes. Now it's been 2 minutes. Now it's my turn to work, and then I'll set it, and it's not my call.
It's the timer.
It's the timer. Right.
So
I love using this, and it's silent, which is great because a lot of our assessments you do have to time a kid to see how quickly they can do something. So the start and the stop is silent, which I love because that could be distracting and annoying to a lot of kids too.
Yeah,
That's much
Great.
there aren't too many sounds that bother me, but alarms really do annoy me because I think I just associate them with waking up, and that's like the hardest thing I do every day.
Well, that's the purpose of an alarm, though, to jolt you.
No, well, I don't
No.
like to be jolted.
Well,
I
maybe
like
you gotta
it.
get one of those like.
Stay calm.
I'm going to send you one of these, okay?
Yes, thank
Send me
you.
your address. I'm sending you one.
You have apps that
I read this article that the first 10 minutes after you wake up, the first 10 minutes is the worst after you wake up, and after that you're fine. And now every time I wake up, I just think like, okay, it's only going to be 10 minutes that'll be bad, and then after that I'll be okay.
You're so positive. I love it.
Yeah. Yeah, I've been trying that. I guess I go through phases too. It's hard. But
All right.
yeah, it is only the first 10 minutes.
She's right.
I have a really amazing alarm clock. It's called a 14-month-old baby boy, and he gets me up pretty quickly at his whim. But I guess my tip or trick is not really so much a trick, but it's just to talk to each other and talk to other people. On if you're working with a kid, to talk to everybody on that kid's team. To get that parent to sign a consent, so you can talk to the pediatrician, the psychologist, the psychiatrist, the OT, the PT, the speech and language provider, whoever it is. I think I absolutely love working with these children and their families. One of the most amazing parts of our job is really just getting to speak with all of you guys. You guys are doing amazing work, and we have so much to learn from each other. This podcast that you're doing is incredible. I love that you're bringing different people on so that everyone can keep learning from different fields. Every time I talk to an SLP, I learn really cool things, whether it's tests I should be using or interventions that they think are, great interventions to use with a specific kid. And I just think talk to everybody. You're not in it alone. This kid has a team and it takes a village.
Yeah.
Finger snap. Can you hear that?
Thank you for my finger snap, Jessie.
You're welcome.
I know.
We dropped a mic. That's over here.
Drop the mic. It can feel like rather isolating too if you don't branch out and you don't reach out, and you shouldn't feel like you have to know everything because you can't.
Mm-hmm.
So it's better to reach out. All right. Well, we like to end our episodes with an inspirational quote. Do you have quotes that you two kind of tell yourselves each day?
Yeah, we in honor of and in the spirit of wine and cheese, the quote that we wanted to share was, age is something that doesn't matter unless you are a cheese.
That's cute.
Yeah, so listen, we're working with kids. Sometimes you have to put your kid hat back on and be a kid with them and get on their level to understand where they're coming from and just to get them engaged in and buy into what you guys are trying to do.
And honestly, we like Jessie said,
yeah.
we're giant kids. Like we have so much fun doing all the things that like we're like, and then I had to play Guess Who. You know, like it's fun. Like my day is silly. Like, you know, I'm like, oh, I have work to do. I have to restock the prize box with cool toys. Should we get more sticky hands? You know,
Right.
Just have fun.
Hands are so popular. I haven't picked those yet. But my hottest prize that I've ever had, it's like probably a tie between whistles and sunglasses.
I thought you were going to say toothbrushes.
No, that's my favorite. I have I put toothbrushes in, and I have a prize wheel now, so like you get what you get and you don't get upset. And when kids land on toothbrush, I laugh hysterically. But now, like, and they get but they all, then it's like all the talk of the day. They're like, I heard so-and-so got a toothbrush earlier. I hope I don't. And I'm like, I hope you do. So it's been quite
my husband is a pediatric dentist. I feel like we could do some cross promotion here. I could put his toothbrush into the prize box.
I ran out of toothbrushes, so you send those my way. I'll do that advertising for you. It's hysterical. And it starts to be like almost more appealing for the kids, for at least somebody in the group to get a toothbrush, because and everyone has that like no reaction, and it's quite that's funny.
I feel like dental hygiene is a and she's practicing proper oral care as an SLP, you know. Just saying oral care is big.
Sometimes
is that a tax deductible expense?
I'm doing my taxes on Friday, so I'm gonna pull up my whole Amazon account and be like, well, can we deduct all of this?
Wait, do you guys have your motivational quote for us?
Oh, well,
we were gonna.
I can come up with one. Mine.
Deb is a glossary of quotes.
I sure am. Mine that I've been telling myself this week is, you can do anything, but you can't do everything.
Oh, that's nice.
Ooh, I'm going to give you that one. I'm going to pass that one directly to Leah, because just like at the beginning of the episode, how she listed all of those things that she does, Leah does everything, and you are amazing at everything you do.
Yeah. But you guys seem like such a great team.
And do everything.
We'll have to come visit you.
Yeah, we should.
Yeah.
Road trip.
I have to plug terrible. My most important job, which I definitely just didn't even list, was I'm a mom too, and a wife. But literally, I forgot to note that on the show.
Well, you noted it now.
Give them a plug. Shout out to them.
Yeah,
Shine and Logan are the greatest. And you should be asleep right now, Logan, so you better not be listening.
All right, so on that note, this has been another episode of SLP's Wine and Cheese. I'm Maria.
I'm Deb.
I'm Jessie.
I'm Leah.
And cheers.
Cheers. Have a good night.
Cheers.
And now, a word from our sponsor.
Hey ladies, I'm kind of sort of loving and openly admittingly fangirling y'all lovely duo of SLP's Wine and Cheese.
Yes, and we love listening to your podcast, First Bite.
Well, thank you. I'm Michelle Dawson, and I specialize in functional but fun treatment for medically fragile kiddos, especially for those that have feeding and swallowing impairments and who use AAC devices as part of their total communication plan. On my podcast, First Bite, we discuss all topics related to early intervention and pediatric speech therapy. We address those worrisome ethics and clinical supervision concerns, as well as jump into private practice ownership and really get into the nooks and crannies of all the things in between by interviewing guest experts in the field. Then, every fourth episode, we bring it back home to my Palmetto State by having evidence-based reviews of case studies or resources with my dear friend and colleague, Aaron Forward, who kind of sort of came up with this whole idea.
First Bite is partnered with Speech Therapy PD, offering evidence-based content in a podcast. Each episode can count as 1 hour ASHA CEU. Find them on iTunes, Spotify, or anywhere else you listen to podcasts.
Absolutely. And thanks for all you do and for spreading joy into the world.
Cheers.